Hey everyone! Today we are going to tackle one of the most common and, let's be honest, often misinterpreted lab reports out there, the Widal test. My goal here is to give you a really clear, super practical guide for interpreting these results for enteric fever, all based on established diagnostic standards. So let's jump right in.
So picture this, right? The lab report lands on your desk. It's a Widal test for a patient with a persistent fever, and you see this jumble of letters O and H next to a whole series of dilutions. You're probably thinking, what do these numbers actually mean? How do I turn this piece of paper into a confident clinical decision? Well, that's exactly what we're going to break down today.
Okay, so here's how we're going to tackle this. It's going to be in four pretty straightforward parts. First up, we'll figure out what a significant result even is. Then we'll walk through the most common single sample scenarios you're likely to see. After that, we'll look at the real powerhouse for confirmation, the paired sample. And to finish things off, we'll wrap it all up with a handy clinical checklist.
All right, before we can even begin to interpret any of these patterns, we've got to know the rules of the game, right? What's our baseline? What's the minimum level of antibodies, that's our titer, that we should even be paying attention to? Let's go ahead and establish those diagnostic thresholds first. You know, the Widal test is, at its core, pretty simple. It's really just looking for antibodies against two main Salmonella antigens. You've got the O antigen, which comes from the cell body, and then there's the H antigen from the flagella. And as you can see here, the significant titer, you can think of it as the cutoff point, it's actually different for each one.
So for the O antigen, the TO, the crucial number to remember is a titer of 1 in 80 or greater. CBO antibodies tend to show up earlier in an infection, so they usually point to a more recent or even a currently active disease. Just lock this number in your head, 1 in 80.
Now for the H antigen, the bar is set a bit higher. Here, the significant titer is 1 in 160 or greater. These H antibodies, they develop later, and they can stick around for a much longer time. And as we're about to see, that has some major implications for how we interpret the results. So remember, 1 in 160 for H. All right, so with our threshold set, let's get to the real meat of this explainer. How to interpret a single blood sample. This is what you're going to see most often in practice, day in and day out. We're going to look at what one report can suggest, and maybe even more importantly, what it can't definitively tell you. So let's kick things off with the classic scenario. The report comes back, and boom, both the O titer and a specific H titer, like say TH for Salmonella typhi, are above their significant thresholds. So what does this combo actually mean? Well, if you look here, this pattern is suggestive of an active enteric fever. To be specific, if both the TO and the TOH are positive, that points towards S. typhi. If it's TO and AH, it suggests S. paratyphi A. But I really want you to notice the key word here. It's always, always suggestive. And this right here really highlights the most important takeaway. A single positive result is not a final diagnosis. The guidance on this is crystal clear. You need confirmation. That means either getting a blood culture or showing a significant rise in titers with a second sample. And don't worry, we're going to get to that second part very soon. Okay, next up on our list, what if only the O titer is elevated? Everything else, all the H titers, they're negative. This is another pattern you'll see all the time. So what's the interpretation here? Well, an isolated positive O titer usually points to a recent infection. But, and this is a big but, it's not specific. And you might ask why. It's because the O antigen is actually common to a lot of different Salmonella species. That means it could be cross-reacting, giving you a positive signal without telling you exactly which serotype is the real culprit. So here we go again, we're seeing that theme of uncertainty with a single test. A single result is really just a snapshot in time. The official recommendation? It's pretty clear. Get a repeat sample in about 7 to 10 days to see if that titer is rising. Or, you guessed it, confirm with a blood culture. Okay, let's flip this around. Now imagine a report where the O titer is negative, but one or more of the H titers are up. This tells a very different story. An isolated H titer is generally not a sign of an active current infection. It could mean a few different things. Maybe the patient is in the recovery phase, the convalescent phase, of a past infection. Or maybe they've had a previous typhoid vaccination. It could even just be a nonspecific amnastic response. And here's the clinical wisdom behind that. The H antibodies, remember, those are the ones from the flagella, they just hang around in the body for a much, much longer time than the O antibodies. So just seeing them there isn't a reliable sign of what's happening right now. All right, last scenario, and this is the simplest one. What if the report comes back and all the titers are below that significant threshold? Everything's negative. So, as you'd probably guess, this result is interpreted as not suggestive of enteric fever. But, and this is super important, your clinical judgment is paramount. If the patient's symptoms are screaming enteric fever, it's totally possible the test was just done too early for antibodies to even develop. In that case, the recommendation is to either repeat the test in a week or just move on to the gold standard, the blood culture. So, we've seen that a single sample is full of maybes and suggestions. Now let's talk about the technique that gives us a much more definitive answer, using paired sera to look for a rising titer. This is really how we move from just a suggestion to an actual confirmation. So here's how it works in action. You take a first sample during the acute phase of the illness. Then about a week to 10 days later, you take a second sample, the convalescent sample. What you're looking for isn't just a positive result, but a dynamic change between the two tests. The whole goal is to see a significant rise in that antibody level. And this brings us to a really crucial definition, a significant fourfold rise. What this means is that the titer in the second sample is at least 4 times higher than in the first one. So for example, it goes from 1 in 80 all the way up to 1 in 320. Seeing that change is what serologically confirms the diagnosis of enteric fever. Okay, wow. We've covered a lot of ground. So let's distill all of this down into a simple, practical checklist of best practices. Things to keep in mind every single time you look at a Widal test. Okay, first and foremost, always correlate with the clinical picture. And remember, a single titer is not definitive. It is just a clue. The blood culture is still the gold standard for confirmation. If you're going to rely on serology, you have to repeat the sample in 7 to 10 days to look for that all-important rising titer. And please, never forget that those H antibodies can stick around long after an infection is gone. So that brings us to the final question that really summarizes everything we've talked about. Is the Widal test a clue, or is it a conclusion? And as we've seen, it is almost always a clue. But it's a valuable one. It's a dynamic tool that, when you interpret it correctly and combine it with your strong clinical judgment, really helps guide you toward the right diagnosis. Thanks for joining me.